So my name is Ronnie Randella. I am a constable with the Metro Vancouver Transit Police. I currently work in our mental health unit as a mental health liaison officer. On a typical day-to-day role, I would start my shift and just kind of look at the previous night, see if there's any sort of mental health components in regards to that shift, see who that client may be, see if they have any mental health resources, and perhaps even reach out to those mental health resources, see if me as the mental health liaison officer for the Transit Police, if I can offer any assistance. Another thing is that we liaise with our jurisdictional policing partners along with the other kind of mental health resources and essentially just work together in like collaboration. The biggest thing is that in regards to, I guess, individuals suffering from mental health issues, my biggest thing is I want to get them the resources that they need in order to make them successful in any sort of challenges that they are dealing with. I essentially want to offer them many resources, any kind of support services, and get them the help that they need.
Well, there was a common theme for quite a number of years of, just mental health wasn't really a big thing. And it's been nice to see that it's come more to the forefront over the last number of years. For me, from my side of things, there seems to be more of an emphasis on that mental health aspect. Folks are getting the treatment and help that they deserve, which is leading to success where their subsequent addictions are being assisted with and then ultimately leading to potentially being housed.
I think there are a lot of complexities in general with mental health. One of the perceptions on the line is if we have someone who's yelling and screaming that they're perceived as dangerous, which is not necessarily true. I think sometimes those people just need someone to hear them out, and we can be that extra resource for them. A lot of times I've spoken to someone, they've just had a mental health crisis and they've needed someone to speak to, and we're a point of contact for them, whether they need transit police or an ambulance or other resources.
When we do apprehend an individual under the Mental Health Act, the biggest kind of frustration that not only myself but other police officers have too is that we wait a very long time at the hospital for that client to see a doctor. I would say upwards of 5 to 6 to 7 hours. My wish is that we can have a dedicated doctor just for police officers, given if we do bring a person that is apprehended under the Mental Health Act, we can essentially hand them over to that doctor at that time. We can go back into the field and essentially deal with more mental health related calls, give individuals the resources they want, and not have to wait 5 to 6 to 7 hours at the hospital to see a doctor.